A newborn baby lies in a delivery room, completely unresponsive to standard resuscitation efforts. The alarms are blaring, and the medical team is rapidly running out of time. The staff adheres strictly to standard, step-by-step clinical protocols, but the baby's condition continues to crash. This is the phenomenon of algorithmic panic, where the rigid adherence to rules, combined with a survival-level fear of failure, actually prevents the team from seeing the patient in front of them. A senior physician steps into the room. He does not rush to the table or shout for a defibrillator. He simply stands still, displaying a distinct, absolute lack of emotion. He steps forward and bypasses the standard sequence of emergency drugs. Instead, he rapidly observes a subtle combination of physical signs, recognizes a hidden pattern, and executes a single, highly specific manual intervention. Within seconds, the infant takes a breath. The rest of the medical staff was overwhelmed by the emotional noise of the crisis. This physician, however, operated in an entirely different mode of thinking, one defined by complete detachment and clarity. We usually call this medical intuition, but we have to ask whether human intuition is simply fast calculation, or if the brain actually functions as a biological antenna, tuning into a deeper frequency of survival that standard medicine ignores. The human conscious mind is highly deliberate, but it processes information slowly and is easily overwhelmed by stress. The subconscious mind operates entirely differently, analyzing massive amounts of data and recognizing patterns in fractions of a second. To explain how this happens, physicists and neuroscientists developed the orchestrated objective reduction theory. It proposes that consciousness and intuition do not come from classical chemical signals, but from quantum computations happening inside ourselves. This animation shows a brain neuron. Zooming in, we find structural lattices called microtubules. These quantum receivers process vast environmental data subconsciously. Panic creates noise, disrupting this delicate computation. By suppressing panic, the physician maintained conditions for the data to resolve into a life-saving pattern. Achieving peak critical thinking during a crisis requires stripping away our emotional reactions so our brain can actually receive the correct data. If the brain is acting as a quantum receiver, we have to find out where the signal is originating. The answer lies in the field of epigenetics. Researchers have discovered that significant survival events and biological traumas leave a permanent chemical residue on our DNA. The historical famines, plagues, and wars that your ancestors survived caused molecular modifications in their bodies. Those specific adaptations were recorded in their reproductive cells and passed forward generation after generation. Your cells contain a massive subconscious database of ancestral survival strategies. When faced with a modern high-stakes crisis, an emotionally clear brain accesses this library of inherited knowledge to find a path forward. Medical intuition is the biological result of the brain combining its quantum processing speed with a genetically inherited database of human survival. The jump from biology to technology happens when we stop seeing intuition as a mystery and start seeing it as a filter. If the brain's antenna is essentially a system for ignoring noise to find a pattern, then that specific sequence of pattern matching can be mapped into an algorithm. This concept became the foundation for Dr. Maya, a cognitive architecture designed to replicate the brain's biological antenna. It processes medical crises with the exact same emotionless detachment as the senior physician. This diagram visualizes the system's logic. It uses a strict, color-coded triage framework based on risk rather than formal diagnosis. Red requires immediate doctor intervention, yellow suggests caution, green advises home care, and blue dictates infectious isolation. When patients experience unexplained symptoms, they naturally panic. The Dr. Maya system filters the panic out of the equation, funneling chaotic inputs into a single, definitive action path that gives the user immediate agency. It takes the highly complex, emotionless critical thinking of a human expert and translates it into a scalable, digital triage architecture. This judgment-first approach is becoming a necessity as modern medicine faces the unfolding threat of antimicrobial resistance. When standard antibiotics no longer provide a universal safety net, the timing and accuracy of the initial triage become the most critical variables in survival. Looking at a standard interface like ChatGPT, the vulnerability is clear. Large language models struggle with triage because they lack the capacity to separate genuine clinical danger from the fear and anxiety of the human typing the prompt. Dr. Maya operates as a gatekeeper for these artificial intelligence systems. It forces the software to process information through a structured framework, teaching the machine to think like a seasoned doctor under pressure. This architecture connects artificial intelligence back to the historical roots of medicine. It reclaims the lost art of observational triage, utilized by pioneers like Florence Nightingale, prioritizing patient observation over blind testing. The goal isn't to replace human expertise with a cold algorithm. It is to build a cognitive architecture that preserves the ancestral frequencies of human intuition, ensuring our technology can navigate the same crises that our biology has survived for millennia.